Hi guys, my name is Sudi. I am 30 years old. I'm from San Diego, California. I'm about to get reconstructive surgery on my stomach. So before we get started, I would really like to point out that over 2 years ago, I did lose weight naturally. I lost over 100 pounds and I did intermittent fasting and counting calories. I worked out, so I basically did what everybody else doesn't want to do. I was left with a lot of loose skin, and right next to my belly button there is a scar that I've had since I was 4 years old, the size of $1, which has brought me tremendous insecurities to my body. Knowing that I didn't have a belly button like all the other girls was really devastating to me, and just growing up hiding all of that, and then plus the weight loss, it's time to get rid of it. I'm so over it. You guys know that if you do want to do something like this, make sure your head is straight. Make sure you're happy with yourself. You're content with yourself no matter what. I went to a therapist for over a year. I seeked help as much as I could for myself emotionally, because I know that this is going to be an emotional roller coaster. So I did want to bring that up, that if you do plan on getting plastic surgery, your mind is completely strong, your head's strong about it, you know what you're doing. Okay, I'm not gonna make this long, but here is this awesome supply list that I've been trying. I will show you guys first what I am taking. As of now, I'm 4 days away from having my surgery. I am taking these collagen packs. They're vanilla flavor, and I love to put these in coconut milk, almond milk, and just mix them up, one packet, and take one daily. And that's what I started taking. I also got this this amazing stuff. It's great for blood flow, and I also started taking this right now, and I'm also going to be taking this after my surgery with a lot of knowledge of this. So this is one of the things I've already started taking 4 days before and following after the surgery. I'm also taking plenty of iron. I started this a few weeks ago just to make sure that my iron levels are where they need to be, and I'm going to take it. I started taking it right now until after my surgery. I'm going to continue taking it after that. And those are the stuff that I'm taking right at this very moment. I stopped my multivitamin. I'm not going to be taking my multivitamin until after my surgery. It was recommended that I don't take multivitamins at least a month before the surgery. After the surgery, I will also be taking this stuff. So this is another collagen that was recommended by her with vitamin C. I'm going to be taking this after the surgery as well. Arnica tea, the famous arnica tea that everybody talks about. I'm not really sure. I've never taken this stuff, so I don't know, but I'm assuming I have to start taking this probably like a day before the surgery or 2 days before surgery, and then following after that. I will be super religious when it comes to this stuff, and when it comes to my water intake, I will definitely be using it. Another natural thing that I'm taking is cranberry juice. I will be taking cranberry juice. I am prone to infections in my urine, so this is definitely a go-to for me. Cranberry juice, the darkest one that you can find. I got this at Sprouts, so I will be taking this. So at this moment, I am 9 days post-op, and I can already tell you cranberry juice has saved my life. Also, the multivitamin that I've been taking for the past 3 months is Vitamin Code. I was taking the GNC women's multivitamin pack, and it was great. I loved it, but it's really expensive. So this is a great alternative. The women's multivitamin from GNC was like $90, and this was about $60 at Sprouts. And I think it's worth it, and it does the trick for me. So I will be taking that after my surgery. I'll also be taking this stuff. It's called Drip Drop, and it's basically like Gatorade but a little bit stronger. And I found this on a website for tummy tuck, recovery, and I bought it. So let's see how this works. I actually never tried it, so we'll see.
So during my recovery, I did end up using this a lot, so I highly recommend it.
I also got some cough drops, because with the incision and with the muscle repair, you really can't cough, sneeze, or anything. You can't really use your muscles. So this is going to be my go-to for me to just take it. Also, it's going to help me with the nausea. I don't know why this stuff helps me with nausea, but I already know I'm going to use this.
So during recovery, I really haven't used these much, but I can definitely see these being used by someone who coughs a lot, or you can easily sneeze. So this definitely does help. I would definitely keep it on my go-to.
For the trip, I bought an immunity support formula from Target, just a simple immunity pack. For the incision, after you take a shower, you will need this cleansing spray. It's antiseptic spray that goes on your wounds, on your lipo, on your little lipo holes or lipo incisions. You use this to make sure you don't catch any bacteria. Everything has to be severely sanitized.
So during recovery, I think this was one of the major things that I use, because it helps me with my wound care, with my drains, to keep everything sanitized and clean.
Before and after the surgery, this is my new body soap, basically.
I ended up using this before the surgery, and after the surgery I found myself still using it. It was great to keep my wounds clean for the days after the surgery as well.
For wound dressing, I was recommended two things. I was recommended this Medi Honey gel and this, Polvos de Sulfa, which is like, it's an antibiotic powder. And you basically combine both of these together into a little paste and place it right on your incision.
So disclaimer on these two products, I was advised not to use them unless I need them. A lot of people use these two products because their incisions take a while to close, some longer than others. It varies, but this was only advised to use if there was any sign of infection.
I have here CBD soap. So I ended up buying 2 pairs of surgical stockings, one for the hospital and one for home. And the reason I did that was because the ones in the hospital are going to get dirty, and the ones for home, I need to have my blood flowing, so make sure you get 2 of these. I also bought a recovery pouch. That's what it's called. And I got this at Amazon, and you basically put it around your waist like so. So with the recovery pouch, you basically just put your drains in it and wrap it around your waist, because it does get really uncomfortable to be wagging that drain around. I also got a thermometer. I bought a crazy amount of disposable diapers or underpads that go on your bed. So I have a lot of them. Here's some more. So same as the pillows, just when you think you're done buying enough pillows, you need to buy more. Same thing with these underpads, you need to buy 1,000,000 of them. I got 2 types of wipes. I got sensitive skin baby wipes, and I got fragrant-free baby wipes. I got plenty of gloves. These are sterile gloves in a Ziploc, so my mom could just have easy access. I got sterile gauzes, and they are about 4 inches wide, and
I ended up using these gauzes on my arms for my brachioplasty. They were awesome.
I got sheets for my bed because I'm pretty sure I'm going to stain my sheets, and I want to make sure that I have easy access to changing my sheets. I got them white so I can throw them in the wash and dump some Clorox on them and clean them properly. Out of all the medical supply lists that I saw, I never saw new sheets, but you will definitely need new sheets. So this is a setup that I had on my bed. I put bed pads underneath the new sheets and bed pads over the new sheets. Just keep myself super sterile and clean. One of the other biggest purchases that I got was a lot of pillows. I got pillows for days. And I got these at Ross for $15, and I think it's totally worth it. And I bought about 3 of these, and they are necessary because I'm going to be going like this when I'm in the car.
So just when you're done buying pillows, you're going to have to buy about 3 or 4 more packs, because I ended up using pillows for absolutely everything. I also ended up buying the Boppy pillow, which was a nursing pillow for my booty, and a ramp pillow, which I'm about to show you guys. So this awesome foam wedge pillow, I definitely ended up using it a lot. I highly recommend it, and it's great because it gives you that hospital bed angle.
Okay, for my relaxation, got some lavender oil. Chanclas, we all need chanclas, we all need slippers. So these are slippers for the hospital. You might want to get some just so you can be as comfortable as you can. That's the key here. Comfortable. I can't stress that enough. Rest. So I got this. So I also got this robe and this nightgown, and I believe I got this at Macy's. I believe it's 2 pieces. It was like $20 something. It's super soft. I love super soft things. So it came with my robe and it came with my nightgown that I'll be wearing. I'm pretty sure I'm gonna be butt naked all the time until like 3 weeks, because it's June. And but I want it to be really comfortable. So this is what I'll be wearing for when I get released from the hospital. What you can't see is my shower chair. I honestly got this on OfferUp for like $15. Great buy. And then I also got this awesome thing. It's my walker that I will be using, and it folds all the way. It folds all the way, so you can put it in your trunk, and it comes with little pockets for your, for your stuff. And it comes with a little chair if I want to sit down. Anyways, this is all of my stuff that I'll have for surgery. I don't have medication to show you. That's one of the things that the doctor will give me after.
So after your surgery, you will get prescribed antibiotics, iron, painkillers, just so you can smooth out the recovery as much as possible. There was a few things that I didn't point out in the video. I ended up buying a 10-foot charger cord for my phone so that I wouldn't have to bend down or have a short cord for that. I also bought a lot of surgical gauzes for my tummy tuck incision and my belly button, so that was definitely a must. The poise pads were basically used more like gauzes rather than anything else, and the adult diapers, I actually didn't use them at all. A lot of girls use them because they leak from their incisions. I didn't really need them at all. Upon release from the hospital, they gave me this Mirena recovery faja, and it was great, and it has been great to fully recover in it because I can size it up. It has an opening in the bottom to use the restroom, and it's very comfortable for the whole healing process. For my stage 2 and 3 of my recovery, I bought a slender waist Colombian faja, which has a lot more compression than the Mirena one. I do not recommend getting such a heavy load of a faja for your first stage. I recommend doing that gradually as you feel it necessary. Thank you so much for watching my tummy tuck supply list. For more information, follow me on Instagram under Zuri_100, and on YouTube I will definitely be posting more about my recovery and my process. Thank you so much for watching.